Hi everyone, I am Dr. Sagar Sau and welcome to Vet Surgery at Each. So today I welcome you to another anesthesiology lecture class. Today we will be dealing with analgesic drugs. This is one of the most important chapter in anesthesiology as well as in emergency medicines, okay, because analgesic drugs are important part in emergency medicines, and today we will discuss about the analgesic drugs. Okay, before going to the lecture, please subscribe to this channel. There will be a subscribe button down here. Okay, please do subscribe because many of you are enjoying the content but not subscribing. Next, you can follow me in Facebook, Instagram and Twitter. In Instagram I post notes, okay, different subjects in veterinary science as well as animal science. What I have collected, all the notes are available in Instagram, you can check that. Okay, now coming to our class, which is basically the analgesic drugs. Okay, analgesic drugs. You see, this classification is based on our from anesthesiology point of view, not from pharmacology point of view, from anesthesiology point of view, which drugs we basically use in anesthesiology for analgesia management. The first line is always opioids, second one is NSAIDs, third is local anesthetics, fourth alpha 2 agonist and NMDA receptor for specially for cats. Okay, for cats this drug is used. Okay, so these different types of analgesic drugs or different categories of analgesic drugs which are used. For opioids, I will discuss separately. For opioids in pre-anesthetics, opioids is a separate chapter, separate lecture. I will discuss details about opioids, but I will also discuss about opioids while comparing with the NSAIDs. This class will be basically for NSAIDs, non-steroidal anti-inflammatory drugs. Local anesthetics, there is a separate class for local anesthetics. For alpha 2 agonist, you will find in pre-anesthetic chapter there is a lecture for alpha 2 agonist, and NMDA receptor is ketamine, which is dissociative anesthetics. For this also there is a class. Okay, so these four will be discussed in separate lecture classes, and this class is mostly about NSAIDs and we will compare with the opioids. Okay, now first, before going to the NSAIDs, you should know some basic concepts like the cyclooxygenase enzyme which is blocked by NSAID, and the prostaglandin synthesis. Okay, how it is synthesized. So first, from membrane phospholipid by the enzyme PLA2 phospholipase A2, arachidonic acid is synthesized. From arachidonic acid there are two pathways, one led by Cox and another is 5-LOX, 5-lipoxygenase, and this is cyclooxygenase. From the pathway in which cyclooxygenase is leading, you will find the synthesis of prostaglandins. First there will be synthesis of prostaglandin G2, then H2. From H2 different enzymes produce difference like E2, D2, F2, I2. TX is thromboxane A2, which is responsible for platelet function. Okay, you don't need to remember all the enzymes. For each one there is enzyme, but you do not need to remember all the enzymes. Simply remember these two, the Cox, that is cyclooxygenase, then 5-LOX, which is 5-lipoxygenase. Okay, 5-LOX synthesize 5-HP, then from which, this is important, leukotrienes are synthesized. Okay, so the first leukotriene which is synthesized B4, then A4, C4, D4 and E4. You do not need to remember all the enzymes which synthesize all these leukotrienes, but you should remember this 5-LOX pathway. Remember these two pathways because they are very important and will be used in next concepts. Next, coming to the different Cox enzymes. Okay, Cox enzyme has three isozymes like COX1, COX2 and COX3. Okay, so COX1 synthesize PG, prostaglandin, those prostaglandins which has the function of mucosal defense. Okay, you see Cox has many functions. I am talking about the functions which are important from the anesthesiology point of view or important from the side effect point of view. Okay, so the COX1 synthesizes those prostaglandins which are responsible for mucosal defense, and also secretes the synthesizes TXA2 thromboxane A2, which is responsible for platelet function. Similarly, the COX2 synthesizes those prostaglandins which are responsible for mucosal erosion healing. You know, the GI mucosa, particularly the GI mucosa, is always prone to erosions because it is continuously moving. There is a peristaltic movement. So there is always erosion. So, for that healing the COX-2 is responsible. Now you get it why NSAID causes the gastric ulceration. Okay. Now also it has the function of renal protection, and also it causes maturation of kidney in neonates. Okay, in neonates it has very important role for the maturation of kidney. Okay. Now the COX-3 synthesizes those PG which initiate the fever. Okay, fever is basically protection mechanism of body. Remember, fever is of two types, which is endotoxin mediated, which is endogenous mediated. You see, there is a lot to discuss. Simply by example, for endotoxin, it's like whether there is a bacterial toxin or viral toxin. Endogenous is basically interleukin mediated pyrexia. So for endotoxin mediated, COX-2 is responsible for initiating fever. For endogenous is for COX-1 and COX-3, particularly COX-3. Remember this one, because when we will go for contraindications, we will know it. Next, classification of NSAIDs based on which enzyme, which isozyme they inhibit. First one, which inhibits the COX-1 and COX-2 very strongly, basically aspirin, phenylbutazone, ketoprofen, ketorolac and flunixin. Okay, they inhibit both COX-1 and COX-2 very strongly. Second category comes preferential COX-2. They will inhibit COX-1 but with a lesser extent, but preferential they will inhibit COX-2, under which the meloxicam, carprofen, etodolac and tolfenamic acid. Okay. Now third category, which only inhibits the COX-2, that is daracoxib and furocoxib. Okay. Next, the most common one, acetaminophen, which you know as paracetamol. It preferentially binds to COX-3. You see, COX-3 initiates fever. Okay, that is why paracetamol is a good antipyretic to reduce down the fever, and they weakly bind to COX-2 and COX-1. Okay. Now we got the classification of NSAIDs on the basis of which isozyme they inhibit. Now understand another concept. See, the NSAIDs, non-steroidal anti-inflammatory, which the drugs which we have discussed, inhibits the Cox enzyme. What about 5-LOX enzyme? Because the leukotrienes and the prostaglandin both are mediators of inflammation. So what happens when they inhibit the Cox, specifically the Cox pathway is blocked. So what happens? The synthesis of leukotrienes will be increased because 5-LOX is not yet blocked. So what will happen? The leukotriene, especially the leukotriene B4, is a potent inflammatory agent. Okay. What we will do, due to the Cox NSAIDs, you know the side effect is, most common side effect is gastrointestinal ulceration. So when you see circulating B4 in blood, will they cause healing of ulcers? Because they are potent inflammatory mediators. So there will be more inflammation, they will potentiate the gastrointestinal effect of these Cox inhibitors. So scientists what they did, so they found a drug which can block or inhibit both 5-LOX and Cox. This is a molecule tepoxalin. This has been approved for veterinary use. Okay, so this drug blocks both 5-LOX and Cox. So what will happen? The benefit of this drug will be you will find lesser gastrointestinal side effects. Okay. So now coming to the contraindications, the side effects in which you should not use NSAID. First one is renal insufficiency. You see the Cox or the Cox synthesizes prostaglandin, which is responsible for renal functions. I already discussed. So in case of renal insufficiency, you should not use NSAIDs, or you should use with caution. In hepatic insufficiency also, because all the drugs are metabolized by liver. Next, these three, the dehydration, hypotension and hypovolemia. In these three conditions, the kidney function is usually compromised. Okay, when the kidney function is compromised, you are not supposed to use the NSAIDs. First, correct the dehydration or hypotension or hypovolemia. When they are corrected, then you can use the NSAIDs. But sometimes they are used, but you should use with caution. Okay, sometimes they are given with monitoring of liver enzymes. Okay, if you are monitoring the liver enzymes, you can use. Next, coagulopathy, the COX-1 synthesizes TX active thromboxane A2, which is basically responsible for the platelet function. Okay, so coagulopathy means there is some problems with regarding the coagulation of blood, or there is disease of coagulation. So in that case you should not use the NSAID, non-steroidal anti-inflammatory drugs, and this one is the most common one. If you are suspecting or you are sure that there is gastric ulcer, you are not supposed to use NSAIDs. And another thing, in case of breeding females, you should use the NSAID in caution because they inhibit ovulation and implantation. In case of pregnancy also, you have to use it caution because they cause delayed parturition, and in lactating mother they cause inhibit the maturation of kidney, okay, because through milk they will go to the infant. So all these functions are mediated by COX-2, okay, COX-2. Almost all NSAIDs inhibit COX-2. So you should use in caution in case of lactating female and also pregnancy and breeding female. Now, which therapeutic consideration we should know about before giving NSAIDs? The first one is age. It should not be used the patients which are less than 6 weeks. It should be used more than 6 week age, and also well hydrated and normotensive, means blood pressure should be in normal, and steroidal anti-inflammatory drug and non-steroidal anti-inflammatory drugs should not be combined because they potentiate the gastrointestinal effect of NSAID, and 2 NSAID also should not be combined. You should give 1 NSAID. Next, preemptive NSAID. It should only be used in case of healthy patient, where specially suppose some patient come for elective OHE. Okay, elective OHE, in those are basically the healthy patients. Okay, they do not have compromised renal and hepatic function, so you can use preemptive NSAID. But some research suggests that in books you will find also, for longer post of analgesia, for post operative analgesia, it is better to give the NSAID at the end of the operation than the beginning of the operation. Okay, so that the post operative analgesia can be for longer duration. Next, it should be given or administered with food, because when you will give on empty stomach the NSAIDs, when there is risk of localized ulcer forms, where they will be in the gastric mucosa, when they will touch the gastric mucosa, they will inhibit the Cox enzyme, and also they will inhibit prostaglandin synthesis, and they will form the ulcers. Next, potential for ulceration exists with all NSAIDs. Okay, all NSAIDs have potential for gastrointestinal side effects, but some of them are little bit safe. For example, meloxicam. Okay, if you will compare meloxicam and carprofen, usually meloxicam after 3 to 4 days or 3 to 5 days you can give meloxicam. After that you may find the gastrointestinal problems, but for carprofen you can safely use up to 2 weeks. If you are giving within therapeutic range, you can give up to 2 weeks. You can find some articles regarding carprofen, especially for osteoarthritis cases. Okay, you can give carprofen for 2 weeks without any problem. And another thing you should remember, what to check or when to stop the medication. If you will find the melena means blood in stool, and vomiting, and third symptom is increased water intake. If you are finding that your pet is taking more water, then you should stop this medication. Okay, these 3 symptoms you should look for in the patient which are receiving the NSAIDs, and if you find these symptoms, then stop the NSAID medications. Okay, so this is therapeutic consideration. Next one, we should compare with opioids. Okay, how they are different from opioids? Are they better than the opioids, or they are lesser than or not so good in managing the pain? Okay, so we will compare the opioid and NSAID. We have made some points. Like first one is effectiveness. Opioids are very much effective for mild to severe acute pain, and is on the contrary NSAID is for mild to moderate and also chronic pain. You see here the term severe pain. Okay, that is why in emergency and critical care, I already told you there is a video regarding emergency and critical care management in patients. You will find that opioids are always the first line of drugs, first line analgesics for emergency and critical care. It is never NSAID. always the opioids are first line of drug. Okay. Next you should know that for chronic pain usually NSAIDs are referred. Next, mechanism of action, they are usually nerve, that means they will increase pain threshold and decrease the perception of pain. They usually act centrally, okay. They will act in brain, central. While there has been reports, they also have peripheral action, that is when given locally or sometimes in intra-articular. Morphine can be used in intra-articular. When they are given also, they also do work. Where in case of the mechanism action inhibit COX, but they usually are peripheral in action, but there are reports they all do possess some central actions. Next, depression. In case of opioids, you will find CNS depression depending on dosage, okay, and also cardiopulmonary depression, but no such effect in case of the NSAIDs. But remember, in case of emergency and critical care, you need some degree of depression, because conscious animal with pain, okay, are very much this causes much of release of epinephrine. When there is more of epinephrine, patient behaves weirdly. So we need some amount degree of depression and also analgesia. That is why the pain, the animal will be tranquilized. Usually you see opioids are very good tranquilizing agents, okay. So when patient will be calm, then the pain perception also not there, because of opioid they are very much effective in severe pains. So the animal will be more, the prognosis will be more favorable. Next, onset of analgesia, opioids are usually rapid, okay. Within 30 minutes you will find the analgesic effects, while in case of the NSAIDs it takes 45 minutes or even more time. But the thing is, the duration is with opioids is very short acting, 2 to 4 hours only. Sometimes we will give out TID or QID. But in case of the NSAIDs, usually 12 to 24 depending on drug. Some drugs are 12-hour duration, some drugs are 24-hour duration. You see, I am not discussing details of the NSAID, like what meloxicam does, what ketoprofen, carprofen, because those are basically pharmacology. But you should read in pharmacology. But I am discussing what is from anesthesiology point of view, okay, what is important from anesthesiology point of view. Then if you are giving repeated dose, what will happen? In case of the opioids, you will find constipation, ileus and urinary retention, okay. And you know about NSAID, they basically causes the most dangerous one, gastrointestinal ulceration, okay. So this is all about the NSAIDs. Okay, next class we will start a new chapter, pre-anesthetics, starting from anticholinergics. Okay, then we will go for different pre-anesthetic drugs. Okay, this is all about analgesic. If you like this video, please share among with your friends, mates, buddies or juniors, seniors, whatever, so that all the knowledge can be reached to a mass. Okay, so we will see you in next class. Tata, bye bye, take care.